Alright, so first we're going to be demonstrating the sterile technique, and this technique uses various personal protective equipment barriers to prevent the spread of infection and microorganisms from transferring. This incorporates sterile gowns, sterile masks, a sterile field, and this can be used in various settings, including acute care hospitals or facilities, as well as for invasive procedures or sharp debridement. And the patient population it's used specifically for are the immunocompromised, as well as patients that are at advanced age or very young age, or diabetics. So step one for the sterile technique is hand washing, and this is one of the most important steps because it's to protect ourselves as well as protect the patients from the spread of microorganisms from contact. So what we do first is we're going to turn the sinks on, and we'll get our hands wet, and then we can get some soap. We're going to rub palm to palm, back of the hand, between the fingers, cup the fingers together, look at the thumbs, fingertips, the palms together again, and then we're going to sweep under the water to get the distal end to the proximal end, just in case sterilization and cleaning of the proximal extremity wasn't as good as the distal. And then I would ask someone else to turn the sink off because I am sterile right now. And then I can reach for the paper towels and have them ready above the lower body so I don't ruin the sterile field. I'm going to wipe from distal to proximal for drying. And then I can throw this away because it's above the sterile field. And then now I'm ready for the next step. Okay, for the next step, what we're going to do is be putting on our gown, and this is a piece of our personal protective equipment. So for our safety, we can only touch the inside of the gown, and we aren't going to let it touch anything else around that's without the sterile field. So I can touch the inside of it. I'm going to slip my arms into the arm sleeves. And since I can't touch the outside of the gown and I need to keep my hands above the sterile field, I would have someone else come and tie this for me. So now that I am gowned appropriately, I can go ahead and put my mask on. And so I can only touch the inside of the mask that will be touching my face because the outside will be considered sterile, as well as how the environment in front of me is sterile as well. Therefore, the outside of the mask is able to touch the surface. So I will put the mask on. If I need to adjust it, I can touch the inside of it to adjust it. And now I will need to repeat the hand washing process before I put my sterile gloves on. Yeah. so I would be opening the kit. I'm gonna start by pulling it away from me, only touching the last inch or so of the fold. Perfect. And then I can go ahead and pull my sheets out. And set them where they are needed. Perfect. If I were to need this one too, I would put this one out, just leave it within my field. And then I'm going to take my gloves off. And then, do I need to wash my hands again? All right, and so now I will be putting my sterile gloves back on. So I'm able to touch the inside of this one in order to put it on my dominant hand, ensuring I'm only touching the inside portion of the glove. Now with this, I can only touch the outside. I'm able to slide this one on. Okay, and then now I'm able to touch everything within my field and to go ahead and debride a type of wound. This type of kit includes gauze, as well as scissors, tweezers, a scalpel, and a small trash bag, as well as a tray in order to keep everything in place. So now that the sterile technique is complete, I can perform whatever procedure is needed using the appropriate measures and PPE I have in place, as well as ensuring that I keep my hands above the sterile field and do not let them drop. I'm not able to touch anything outside of the sterile field or anything that is contaminated, or else I will have to repeat the entire process over again. And so now I'm going to show you how to take off the personal protective equipment, also known as doffing. And so for this, we would start by taking off the gloves. And to take off the gloves, we want to protect ourselves in the process, and so we can't touch anything with our bare hand that is considered contaminated. So I'm going to begin by taking off my left glove, and I can touch the outside of the glove. So I would pull this off, and now with the opposite hand, I can only touch the inside of this glove. So I'm going to stick my hand underneath, and then I can pull this glove off. And now I'm able to take my gown off, which at this point I can touch the gown because I am done with preparing for the sterile field, and I am able to take it off, and then I will wash my hands afterwards. So again, for my protection, I'm trying my best to only touch the inside of the gown because the outside is probably considered contaminated at this point. I'm stuck. Okay. Perfect. And then this would go outside of the sterile field. And then I will continue by washing my hands for 20 to 40 seconds longer if need be, depending on the type of procedure that was done. Are you done?
We're going to be demonstrating the clean technique today. This is used to reduce the risk of transmitting microorganisms between provider and patient. It's mostly used in physicians' offices and long-term care facilities, and it's used for simple procedures on patients with a low risk of infection. So the clean technique starts with either a hand wash or a hand sanitizer. With the hand sanitizer, you're going to start out with a couple pumps. You're going to rub your palms together. You're going to flip your hands over, get between your fingertips and the back of your hands, flip them back over between your fingertips, and then you're going to get your thumbs just like this, and then you're going to put your fingertips together, rub your palms, and then wait for them to dry. So after our hand washing or hand sanitizer, our hands are considered clean. The first thing we're going to do is we're going to put our gown on. As our hands are considered clean, we're able to touch both sides of it. So we just unfold it, slide your arms in, make sure it doesn't touch anything that's not considered clean. But you're able to touch both sides, so you're able to pull your sleeves up, and you're able to tie your own gown. Once our gown's tied, our hands are still considered clean, so we're able to touch both sides of our mask, and we're able to just put it on and scrunch them. All right. So once our gown's on, our hands are still considered clean, so we're able to touch both sides of our mask. So we're just able to loop it around our ears and scrunch our nose. But then we're going to go back for another either hand wash or hand sanitizer, following the same procedure we did before. And following that, our hands are considered clean again, so we're just able to open our package here. Our package is considered sterile, so we're able to just unfold it, continue unfolding it. Once we get to the gloves, we want to spread our paper out, and since our hands are considered clean and the gloves are considered sterile, we want to try to maintain that, so we're going to grab the inside of the glove with our clean hand and just slide it on. And then making sure not to touch the sterile part, we're going to try to roll it up over our gown. And then for the other glove, we're able to touch the sterile part since our glove is considered sterile. So we do the same thing, just grabbing a different part of the glove. Do the same thing. We're going to roll it up over our gown, and we're ready. All right, so we've performed our treatment, and now to take off our PPE, we're going to start with our gloves. We're going to try to only touch the outside, not touch any of our skin. We're just able to kind of roll them off. And then with this one, you want to make sure just to touch the inside of the glove, just roll it off. Following that, we're going to do our hand hygiene, just make sure nothing's transmitted to us. So we're going to do more hand sanitizer in the same way we did before, making sure to clean every surface of our hands. And following that, we're going to untie our gown and remove it, just pulling it off. And again, we're going to perform more hand hygiene before we get our mask off. And the final step is removing your mask, and one last round of hand hygiene.